Getting cancer is like getting a death sentence, so it's very crucial to treat it in its early stages. However, a lot of people don't even take notice of the many signs it has until it's already too late. So, today we're looking at signs of cancer that women frequently ignore. The physical makeup of women varies frequently. She will undergo further physical changes as she ages. A few of the changes that women experience, regrettably, may seem commonplace, but a lot of the time, that may be far from the truth, and indicators of cancer may occasionally appear. Women should be familiar with their bodies. It's crucial for a woman to keep track of the changes that her body undergoes as a result. In order to be sure that nothing is wrong with our health, we should all be vigilant and take the required action once we observe a change. Before we continue with the video, a brief request from us. If you find value in these sorts of content, please don't forget to subscribe and hit the notification bell so that you don't miss our valuable content on health in the future. Now, here are some common signs of cancer that women often take for granted. Number 1. Persistent fatigue. If you have had extreme exhaustion every day for longer than 2 weeks, even after a restful night's sleep, you should seek medical attention. There are numerous factors that can make you feel exhausted. Anemia and depression are two of the most typical medical reasons for weariness. Cancers like leukemia and lymphoma, however, frequently show symptoms including a shift in energy level. To make it easier for you to see changes in your health, try to recall how you feel when you're in a fantastic condition. Only by comparing and contrasting, you would be able to have enough information to go to your medical professionals or your common physician to ask about any concerning issues. Number 2. A hard time swallowing. It's normal to occasionally struggle with swallowing, but if it happens frequently and you're also losing weight and vomiting, you could have stomach or throat cancer. After a few weeks and these symptoms continue to persist, you should go see your doctor so that they can thoroughly examine what might be wrong with you. Number 3. Stomach pain and nausea. It would be careless to assert that upset stomachs indicate cancer when they are so frequent. Most likely you just consumed a portion of food that your body didn't like or are more under stress than normal. Perhaps you may even have a digestive condition like IBS, irritable bowel syndrome. It's time to seek out medical attention if you have nausea that won't go away or experience abrupt and severe stomach pains that last longer than 2 weeks. Leukemia, esophageal, liver, pancreatic, or colorectal cancer are among diseases that can cause stomach discomfort and nausea. Number 4. Sores or pain in the mouth. There is nothing to worry about if you occasionally acquire a cold sore that goes away following treatment. However, any mouth discomfort that persists for more than 2 weeks or a sore that doesn't heal should raise some worry. It's also crucial to pay attention to any jaw pain, numbness, or swelling. Additionally, it's critical to conduct a monthly oral self-exam, particularly if you use tobacco products, drink frequently, or your family has a history of oral cancer. Number 5 is persistent bloating. Women frequently bloat during their period or just after a particularly high carb meal. Seek medical attention if the bloating persists and includes weight loss or bleeding. Bloating or a persistently constipated feeling may be an indication of ovarian or uterine cancer. One of the typical cancer symptoms that many women neglect is persistent bloating. It might also be pancreatic cancer, digestive system cancer, or even colon cancer. Number 6. Bleeding between periods. Speak with your doctor if you're spotting all the time between cycles. Any bleeding that occurs outside of the menstrual cycle could have a variety of causes. Be aware of any changes to your menstrual cycle as your doctor will want to rule out endometrial cancer. Number 7. Chronic headaches. If you generally get no headaches and have no history of migraines, the sudden development of chronic headaches may indicate a problem. There is probably nothing to worry about if you have already been diagnosed with migraines and your therapy is effective. However, this health shift could be explored with your doctor if you have never experienced headache issues but now find yourself yearning for a quiet, dark area. Number 8. Blood in the urine or stool. Hemorrhoids are typically to blame for blood in the stool or urine. However, it might also be a symptom of colon cancer. Consult your doctor if you have bleeding in an area that generally doesn't hemorrhage, particularly if the bleeding continues for more than 2 days. Number 9. Coughs. The majority of those who develop coughs observe it disappearing after 4 weeks. Any cough that persists for more than a month needs to be taken seriously. Consult your doctor if you smoke or experience breathing difficulties as a result of this cough. The most typical indication of lung cancer is this coughing. Try to cut back on how many cigarettes you smoke each day and schedule an appointment with your doctor to find out what is causing your cough. If you notice that coughing persists for an extended period of time and you have ruled out a cold or any other disease, then try your best to get it looked at. Number 10. Sudden weight loss. Many women wish they could lose weight effortlessly. However, something might not be right if this weight disappears without an additional exercise or dietary changes. Unexpected weight loss is typically brought on by stress. However, occasionally it's brought on by colon or pancreatic cancer. Visit a clinic to rule out the possibility of cancer or any other ailments if you discover that you haven't changed your diet or exercise routine but are still losing drastic amounts of weight. Number 11. Changes in the nails. One of your toenails having a thin, vertical brown stripe could represent melanoma, a type of skin cancer. If you observe any unusual changes in your toenails, you should talk to your doctor to make sure that it isn't melanoma, because this is a concerning indicator that suggests that the cancer is growing and spreading inside you. Number 12. Lymph nodes changing. Our immune systems are supported by lymph nodes, which also serve as filters for invading substances like cancer cells. It may be fatal to have lymph node cancer. These lymph nodes typically change when they become infected. Usually, innocuous infections are fought off by the body. However, in other circumstances, including leukemia and lymphoma, they also result in the lymph nodes swelling. Speak to your doctor if the swelling has persisted for at least a month. Number 13. Changes in the breasts. A lump in the breast is frequently not a sign of cancer. However, you should see a doctor if you find a lump in your breast. Tell your doctor as soon as you observe any nipple discharge, nipples turning inward, or any redness or scaling of the nipples. Number 14. Developing a fever. When people catch the flu, they experience a fever that lasts for a few days. This varies from person to person. However, a fever that does not go down can indicate a number of different things. The reason for the fever may be leukemia or any other type of blood malignancy. Visit your doctor or the emergency hospital if you have a persistent fever and are unable to establish the source of it. Last but not the least is 15. Postmenopausal bleeding. Sudden onset of vaginal bleeding should always be brought up to a doctor if you have had menopause, which is defined as not having had a period for 1 year. Hormone replacement therapy, infections like a UTI, or a non-cancerous growth called polyps can all cause postmenopausal bleeding. This, however, can also be a sign of more serious health problems, like uterine or cervical cancer. Neglecting menopausal bleeding is not advised. No matter what the cause, get help right away to acquire a diagnosis and a treatment plan. Keep an eye out for your health and contact your doctor if you notice any changes now that you are aware of some of the most prevalent cancer symptoms that women often neglect. If you lead a healthy lifestyle and eat nutritious food, but you realize that your health has recently deteriorated, take the necessary precaution to make sure that you are not in any sort of danger and any significant illnesses as a result of this shift. Try incorporating some healthy lifestyle modifications into your daily routine if you aren't active and your diet needs improvement. We hope you enjoyed this video. Also, be reminded that this video is for information only and we do not claim to provide medical advice that is tailor-suited to your needs. Be reminded to consult with a medical professional and seek personalized healthcare that will definitely fit you. Also, post some of your advice and what indicators you personally utilize in the comment section below. Additionally, leave a like, subscribe, and click the bell button to receive information on our new health-related videos. If you want to watch more of our content, check out this video in the lower right corner. You can also check out our playlist of other related content. Anyway, see you later, and thank you for watching.